Hi, this is Darlene White, and I'm going to be doing the part of our video about autism spectrum disorder. Autism is a neurodevelopmental disorder that's usually diagnosed between the ages of 12 and 24 months, and currently almost 1% of the population of the U.S. is being diagnosed with the condition, which is an increase in the past before the Diagnostic and Statistical Manual of Mental Disorders changed the diagnostic criteria. The main diagnostic criteria for autism spectrum disorder are deficits in social communication and interactions. There can also be failure to initiate and respond to social interactions, nonverbal communication behaviors, not understanding nonverbal communications, such as if a parent was displeased and putting their, maybe crossing their arms and with an angry face or an upset face. A child with autism spectrum disorder may not recognize that as the parent being unhappy or displeased. There are 3 levels of severity of this disorder. They're based on the level of support required. They go from requiring a little bit of support to requiring substantial support, and each one has functioning difficulties and will hamper independence. As the severity level increases, rather than just having trouble with functioning, such as switching between activities, extreme distress or difficulty changing focus or action, and restricted or repetitive behaviors, difficulty coping with change overall. And then level 3 is extreme difficulty with change, restricted repetitive behaviors that markedly interfere with functioning in all spheres. The disorder can be accompanied by an intellectual impairment or language impairment. The main thing with autism spectrum disorder is social communication is restricted. Repetitive behaviors should be separately rated according to the DSM-5. Also, according to the DSM-5, regression and losses in social communication during the first 2 years of life is a major indicator of the condition. This means not just that the child may not interact socially, but from the time about 1 to 2 years of age and on, the child actually begins to lose whatever levels of communication they may have had. Some things about gender-related diagnostic issues. There are 4 times more males than females are diagnosed. Some things that need to be considered to make sure that you're doing an accurate diagnosis is Rett syndrome can look like autism spectrum disorder. The difference being that while Rett syndrome can be, the side effects of it can happen between 1 to 4 years of age, and they will present, generally girls, they'll meet the criteria for autism spectrum disorder, but if it is Rett syndrome, their social and communication skills will diminish. In other words, what look like autism will actually revert back to a more average behavior as far as communication. Other things to pay attention to before making a diagnosis are language disorders or social communication disorders, intellectual disability, So intellectual developmental disorders should be assessed. Stereotypical movement disorder should be assessed. Attention deficit hyperactivity disorder and schizophrenia should all be assessed to make sure you can rule those out before giving a diagnosis of autism. The functional consequences of autism spectrum disorder are adaptive skills that measure below IQ, extreme difficulty planning, organizing, or coping with change that negatively impacts academic achievement. Many individuals with autism spectrum disorder, even without intellectual disability, have poor adult psychosocial functioning. This goes back to their inability to have effective intercommunication. And one thing that is mentioned in the Francis book is that we need to make sure that we don't overdiagnose autism, because that can affect a child if they don't have that and then they've been labeled with that and placed in school groups, and that can be detrimental to them overall. That's the information I have for you. Thank you.